Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Amir Sohail Khatak, working as a children specialist in Hyper Teaching Hospital, Peshawar. Dear colleagues, today we will discuss EEG. EEG is the abbreviation of electroencephalography. This investigation was used for the first time by a German psychiatrist Hans Berger in 1924. It basically measures the study of electrical activity of the brain, especially cerebral cortex. The mechanism of electroencephalography is the sum of excitatory postsynaptic potential and inhibitory postsynaptic potential. These are basically graded action potential of dendrites of the cerebral cortex to be recorded on a EEG paper. For electroencephalography, the patient is to be sedated. For this purpose, a syrup is used, that's chloral hydrate, available on the name of sedate, and the strength of 500 mg per 5 ml. The dose of this syrup is 30 to 50 mg per kg per dose. The beauty of this syrup is this, it does not suppress epileptiform discharges seen in epilepsy. The speed of paper on EEG is 25 mm per second. The electrode placed on the scalp of the EEG machine is called montages. These are basically 10 to 20 in number. It is of two types, unipolar and bipolar. In unipolar montages, one electrode is placed on the scalp and the other electrode is placed elsewhere in the body. In bipolar, both the electrodes are placed on the scalp. On EEG paper, we see two types of number. Even number represent right side of the brain and odd numbers represent left side of the brain. And these changes, waves are some of the vectors of all discharges. Significance of electroencephalography. Electroencephalography is basically used for diagnosis of neurological dysfunction and study of sleep patterns or sleep disorder. In neurological disorder, the most commonly used is in the diagnosis of epilepsy. Epilepsy is basically excessive impulses from cerebral cortex. It is used in the disorders of midbrain, especially ascending reticular activating system. It is used in subdural hematoma, collection of blood in subdural space over cerebral cortex. On the basis of regularity of waves, there are two types of waves. One is synchronized or invariant waves, in which the waves are of uniform frequency and small changes in amplitude is seen. In irregular or variant waves, these waves are having changes in amplitude and frequency or both. On the basis of morphology, waves are of two types. One is spike and other one is waves. In spike, the changes are abrupt and almost seen always pathologically. And waves can be pathologically or physiological depending on the age of the patient. On the basis of frequency, that's number of waves per second. It can be divided into delta waves, theta waves, alpha waves and beta waves. Alpha waves. Alpha waves are obtained from the occipital region of the brain. These are synchronized waves. Inattentive brain, drowsiness or light sleep with eyes closed. No visual stimuli or mental efforts. Frequency is between 8 to 12 waves per second and amplitude is between 50 microvolts. Beta waves are obtained from parieto-frontal region. These are desynchronized waves seen during mental activity, mental tension, arousal states, eyes open. Frequency is between 15 to 60 waves per second. Amplitude is between 5 to 10 microvolt. If the frequency of the beta waves is between 30 to 100 per second, then we call it gamma waves. Gamma waves are basically obtained from reticularly activating system. Gamma wave is seen during active problem solving, learning and attention. Delta waves. Delta waves are obtained from thalamus or reticular activating system. Its frequency is 1 to 5 waves per second. Amplitude is 20 to 200 microvolt. It is seen normally during early childhood, waking adult, sleep, and pathologically seen as stupor, epilepsy, increased intracranial pressure, mental deficit or depression, increased carbon dioxide, decreased oxygen in the blood, hypoglycemia, hypothermia, brain injury, anesthesia. These waves are not affected by stimuli. Theta waves are obtained from parietotemporal area of the brain. These are seen in below 5 years of age. Frequency is between 4 to 8 waves per second. Altitude is 10 microvolt. These are basically obtained from hippocampus and is seen in emotional stress in adults. It is also seen in children and degenerative brain disorders.